Good afternoon. My name is Phoebe Benjamin, and I'll be doing a case study of a 54-year-old man who suffers headache and dizziness. In this summary, I'll be looking at the case summary, importance of demographics, medical term analysis, medical abbreviations, differential diagnosis, significance of medical terminology. Patient case summary, detailed clinical presentation. A 54-year-old Caucasian male with a 10-year history of classical migraine that is effectively managed with sumatriptan presented with a 3-week history of progressively worsening dizziness, right-sided tinnitus, and a mild diffuse non-throbbing headache. No visual auras, which typically precedes its migraines, are noted. He denies nausea, vomiting, or focal neurological deficits. His family reported possible hearing difficulties. On physical examination, vital signs are normal. There is right-sided hearing impairment, unsteady gait when eyes are closed. An MRI of the head with contrast revealed a 2 cm mass at the right internal auditory meatus, extending into the auditory canal with no impingement on other cranial nerves on the cerebellum. An acoustic neuroma is diagnosed. Significance of patient demographics. An accurate diagnosis that includes the demographic details and medical case summary crucially shape the therapeutic approach. In any diagnosis, understanding racial demographics can guide screening for different epidemiological patterns. Demographics are used in healthcare to deliver culturally sensitive, patient-centered care. Defining medical term, tinnitus. There are symptoms characterized by the ringing, buzzing, or hissing in the ears unrelated to external causes. Vertigo is defined characteristic by a false sensation of spinning or movement, and neuroma is a benign tumor originated from nerve tissues. Defining common medical abbreviation, MRI, which stands for magnetic resonance imaging. It's a non-invasive diagnostic imaging technique that produces detailed images of internal structures. BP, known as blood pressure, it's cardiovascular status that measures the force exerted by circulating blood against arteries. And head, eyes, ears, nose, throat. It is a standard physical examination on the anatomic region. Differential diagnostic evaluation. Acoustic neuroma as the most likely diagnosis. Differential diagnosis evaluation examines most likely diagnosis, different reasoning, alternate diagnosis, specific findings, and rules out unrelated causes. Significance of medical terminology. The critical role of medical terminology in healthcare settings. Understanding medical terminologies, which are precise and standardized terms, in an indispensable foundation for effective, respectful communication medical documentation, accuracy, patient safety, professionalism, and ethical care delivery. Thank you.